Working as an internationally educated nurse here in the UK brings about several challenges. Some of these challenges are easily overcome, others are ever present. Hi, my name is Jarwin, and I'm a Pinoy nurse here in the UK. And for today's video, we will be talking about our disadvantages as internationally educated nurses over the locally trained nurses. More specifically, I will be relating this video to my personal experiences as a nurse who transitioned from practicing in the Philippines to the UK nurse practice. So this might not even be true for you because, I don't know, maybe you've got a more extensive clinical background, you have worked in a clinical setting, a healthcare setting that's pretty much like what the UK has. So again, this may or may not be true for you, but it is for me. Okay, here's the first one. It's the multidisciplinary healthcare team, the continuity of care. Okay, so in the Philippines, we know for a fact that most individuals pay for their healthcare, right? As a Filipino nurse, we know that our healthcare system back home has a lot of flaws. It's got a lot of holes. If it was a microbiologist looking at it, he would say TMTC, too many to count, right? And because majority of individuals pay for their health care, it's very seldom that when a patient is admitted in the hospital, besides the doctors, the nurses, and the midwives, they barely see any other healthcare professional except maybe the occasional visit from the phlebotomist or the medical technologist, or when they pop into the radiology department for an X-ray, MRI, or CT scan, or whatever. Besides that, that's pretty much how the inpatient stay looks like back home. So that when the patient is discharged, chances are he or she will not even see these healthcare professionals anymore, except maybe for the doctor for the follow-up checkup, right? Anything that patient needs post-discharge, the family takes care of. Although in theory, we as nurses have been taught about the multidisciplinary healthcare team, the continuity of care, the holistic care, I guess it's safe to say that we haven't really experienced this because of the existing system back home. This tunnel vision experience of healthcare I've had in the Philippines was completely revamped when I came and started working in the NHS. It was when I came here when I started to figure out, or started having to figure out, how all these different healthcare professionals fit in the patient's care. Because really, I haven't had the first-hand experience of this. So I had to figure this out myself, of course with the support of the training staff back in our trust. But really, it's my first time being able to appreciate this multidisciplinary healthcare team in action. So I work in an orthopedic ward. So we work very closely with physiotherapists. So that's when they assess and help out these patients with their mobility. If we have patients who have problem with pressure sores, moisture lesions, or their skin integrity, we call on the tissue viability nurses to come and prepare a care plan for them. If one of our patients is diabetic and is having problems controlling his or her blood sugar, we call on the diabetic team so that they make a plan centered around that patient so that we can make it work. Of course, if, say for example, a patient is an elderly, one of the older patients, we call on the ortho geriatric team so that they can make a review and prepare a plan for this patient so that he or she can receive medical care that's appropriate for his group, age group. There you go. And let's not forget that before a patient is discharged, sometimes the social services step in, especially when that patient does not have a house. So we try to sort out that patient's lodging before we discharge him or her. Moreover, if a patient needs help with activities of daily living post-discharge, we then arrange a package of care so that a carer goes to that person's residence and help out with his or her ADLs. We make sure that these patients recover, and our responsibility as nurses, as healthcare professionals, do not end in the hospital. Now, if that patient's need post-discharge is more complex, we involve the community nurses or district nurses or any other healthcare professionals that we need in order for that patient to thrive in the community. Of course, let's not forget the GP. The GP is brought to speed with whatever's happening to the patient, because that healthcare professional is an integral part of that patient's care. I'm saying all this to you now, but when I first started, it was all new to me. Even though we have been taught in nursing school about the multidisciplinary healthcare team, we haven't really had the chance to appreciate and experience this firsthand back at home. Whereas for the nurses who are newer than me and are locally trained, they have been going about this system at ease, because this is where their training revolved around. Whereas for us, internationally educated nurses, Pinoy nurses, it's more of in theory, because this is not our healthcare system back in the Philippines looks like, right? Again, you might have a better grasp of the multidisciplinary team, healthcare team, than I do, because, like I said, my clinical experience is not that extensive, whereas you might have had a more extensive experience in a healthcare setting that's more akin, more similar to what the UK has. So number 2 on what I consider as a disadvantage for an internationally educated nurse over a locally trained nurse is with the documentation. I'll be honest with you. When I was still practicing nurse back in the Philippines, my nurse notes would consist only of a few lines. That's pretty much it. That's my documentation for the entire shift. I'm really bad with documentation. I hate writing. Let's just call it frugality with others. Others call it laziness. Well, anyways, as an internationally educated nurse, now working in the UK, it took me a while to get used to documentation here because of the several different forms that we need to fill, and there's also the software, the computer softwares that we need to do as well. So here is a list of the different paper forms that we have back in our trust. There's not an exhaustive list. It's just those that I can remember off the top of my head. There are others, but of course that depends on the case of the patient. You do not have to do all these. It really depends on what kind of patient you have, right? Now, for the systems in the computer, these are, I'm just going to give you an example of what systems we have. The ones that we use for drug administration, the ones that we use for our observations, the vital signs taking, the blood glucose monitoring, all these communicate together and are put in a repository where all healthcare professionals that are involved in the patient's care are able to view, so that these healthcare professionals, doctors, physiotherapists, other nurse specialists, can review what's happening to the patient, even if they're, let's say for example, in the ward or in a different ward or in a remote area. So having this system gives us the ability to consult and refer to different healthcare professionals more easily, and it also enables us to hand over seamlessly, and of course with the continuity of care, it helps put it, or it helps keep it at an optimum level because of these systems that we have in place. Now, again, for an internationally educated nurse like me, I had to learn all these systems and, of course, how to fill the paper forms properly starting from day one on the job. Whereas for locally trained nurses, they have been taught how to complete these, how to do these during their placement. And if that particular nurse has done his or her placement in that specific hospital, in that specific ward, then the easier it is for him or her. Number 3, we got language barrier. So here in the UK, it's pretty much like a plethora of different colors, cultures, and race. Here, this is where you'll experience the different accents, the different body languages, the different expressions, slangs, jargons, and idioms. It's more than just learning how to speak English or British English. It's also about acknowledging or recognizing the different groups that try to do that, or who are trying to do that, what you are doing, what we are doing as internationally educated nurses. We are trying to speak their language, and we need to recognize that there are also other groups of people who are trying to do the same. And that, for me, is the more challenging part. It's when you get a very thick accent that some of the information that is being delivered to you gets lost in translation, and this can be very difficult and dangerous when a patient handover is being done. So this is when I say, I apologize. Can you please repeat that? Because it's okay to have that person repeat what has been said. What's important is we get the gist, or we get the specifics of what is being handed over to us, especially when it comes to the care of a patient. Now, the fourth thing that I would consider as a disadvantage for me when I started as an internationally educated UK nurse is the equipment. Of course, back when I was still in the Philippines, I've already handled some of the equipment that we use in our ward now, except that they have a different configuration, or they have a different setup. So I had to learn how to use these equipment, and fortunately most of them are pretty straightforward. A lot of them are foolproof, so it's really easy to learn how to use these equipment. It's really just about taking the time to go through them, learn how to use them, and of course know how to troubleshoot these things. And obviously for nurses who are locally trained, these would have already been taught to them during their placement in that hospital. The fifth and last disadvantage that I would consider for myself is the local policies. On the first few days after starting as a UK nurse, we were bombarded with these documents, long, wordy documents, and these are the local policies of the hospital that I work at. And this is true for all the institutions, the healthcare institutions here in the UK. They have policies, local policies that they use as a black and white that serve as guidelines for nursing practice or healthcare professional practice. These are their black and white, and they guide us. They tell us what to do in certain circumstances. Okay, and they comprise a great number of documents that we have to go through during the orientation. And for an internationally educated nurse like me, who was just about to take the OSCE, this has added up to my already very steep learning curve. So I had to learn these local policies and at the same time prepare for my OSCE. So this was really one of those things that is lengthy and boring, but cannot be neglected because they form part of your practice as well. So it was really difficult the first few days, the first few weeks actually, starting out as a nurse. Actually, the first few months. Oh my gosh. So again, these are what I would consider as disadvantages. These were my disadvantages when I was starting out as a UK nurse. Being an internationally educated nurse, our curriculum or our training revolved around a different kind of program compared to the nurses here in the UK. So yeah, it's if you look at it in the grand scheme of things, it's not really that big of a problem. It's just that it's these tiny things, when you put them together, it just stacks up and blows your mind really. So yeah, once again, these are my disadvantages. Yours might be different. These things might not even exist in your disadvantages list when you start working in the UK. Again, especially for those nurses who have very extensive healthcare experience and those who've worked in a healthcare setting that's similar to what the NHS has or the UK has. So just to recap, we have discussed about the multidisciplinary healthcare team. We also have discussed about the documentation, different systems, paper, forms and such, the language barrier, the equipment, and the local policies briefly. Now, if you like this video, please go ahead and hit the like button. I also have other videos like this in my channel, Charwin Belisario, so you are very welcome to check them out. And if you find value in these videos, please go ahead and subscribe. And make sure to hit the notification button as well. And once again, my name is Charwin. I'm a Pinoy nurse here in the UK.